Buenas tardes, bienvenidos. Now we are in the Panama clinic. It's both the best and worst name because it gets so confusing. And I'm here with one of the most interesting medical doctors I found here in Panama. Shall we walk there?
Sure.
This is Dr. Luis Picard-Ami, and he not only spent a substantial time working as a plastic surgeon here in Panama, as well as in the United States and in Canada. So I thought it was really an interesting story. He moved places many times throughout his life, and he consulted patients and operated patients in Spanish, English, and French. And so it was really interesting. So as we were talking before, you are Panamanian.
Well, I'm Panamanian by blood because my father is Panamanian and because I've lived in Panama most of my life, but I was actually born in the United States, so I have dual citizenship.
And you grew up from 3 years old
Yes.
here in Panama.
Yeah, I was born in Connecticut. I came to Panama when I was about 3 years old. Spent my early childhood here until I was about 14. My dad was a physician. He is a psychiatrist. He trained at Yale University, so he spent 3 years in Connecticut. During that time, I was born. So after he finished his training, he moved back to Panama. So I came to Panama when I was almost 3 years old, and I spent here my early childhood. Then, out of a token of good behavior, I got sent to a military school in Philadelphia called Valley Forge Military Academy, but I guess it worked because I went from being a troublemaker into medicine. And I knew that my father was a prominent physician in Panama and that my chances of getting into the medical school here were good. And people who had gone to this medical school had been able to go to overseas to train in pretty much anywhere they wanted. So I went into the competition and I got in and I did my medical school here.
So you chose to study medicine here in Panama because your father being a professor and you had better chances. So you did consider studying medicine in the United States when
Yes.
you were there?
Yes, actually, because I had done my high school in a military school, I got offered a scholarship to go to Walter Reed, which is a medical facility attached to the U.S. Army. And they offered me, but at that time, I was still a teenager. I wanted nothing to do with the military. I had had enough. So I said, no, I'll take my chances. I'm going to go back to Panama. I know it's a very good medical school. People who get out of there can go anywhere they want in the world and do what they want. And with the model of my father having done it, I said I'll do my medicine in Panama and then do my surgical training abroad. And it worked out.
And when I came to Panama first, I was deciding whom to interview here, and I saw that a lot of medical doctors in Panama trained abroad. And at first I thought that perhaps it was because of their contact with the United States, because of the canal and the administration. So for that reason, perhaps a lot of Panamanian medical doctors go for residency in the United States. Later I found out that it's pretty much because Panama has 4 million inhabitants. So it's almost like a city. It's less than Rio de Janeiro, for example. So how many plastic surgery residence spots are there in Panama?
Well, actually in Panama, we don't have formal plastic surgery training. So everyone who's a plastic surgeon in Panama had to train abroad. So you could do general surgery, which is 5 years here, but then the plastic surgery you would have to do abroad. And very often what happens is if you have done your general surgery in another country, they don't want to take you for the plastic surgery. So I knew that from ahead. So I decided to do everything, general surgery and plastic surgery in Montreal at the McGill University. But then I knew I wanted plastic surgery, so plastic surgery training is not available in Panama. So I went to Canada and did my plastic surgery training. And it happens that we're 44 plastic surgeons in Panama for a country of 4.5 million. So all of the plastic surgeons in Panama trained abroad.
It's a really surprising thing. Like I said, it's these are the peculiarities of being a small country. Things just work differently. Like I said, 44 plastic surgeons. I mean, there are many states in Brazil that are going to have way more plastic surgeons than that. It's really interesting. But you ended up not going to the United States. Actually, you went to Canada. And actually, Dr. Luis Picard-Ami, despite his name, he is of French ancestry, but he did not already speak French when he went to Canada. Mais après être à Montréal, à McGill, pour 6 ans, dans ce cours de chirurgie plastique, il est maintenant fluent en français.
Ah, pas fluent. Je parle un peu, parce que je n'ai pas de pratiquer pour 25 ans, ainsi que I can get by, I can communicate with the patients, but definitely English or Spanish are my mother tongues. But yes, it's an interesting thing because when I speak to colleagues from other countries and they have meetings or how they elect their boards is very, very different to how we do it here. I personally know every single plastic surgeon in the country because we have meetings every month. So everything is in person, and everybody knows the other plastic surgeon, how many kids he has, if it's his first wife or his second wife. We are very, very a very close community. We have all of our meetings in person. We have our party, for example, next week we're going to have our Christmas party, and all 44 of the plastic surgeons are going to be there with their better halves. So everybody knows who everyone is, and that's very peculiar because, as Ricardo said, in many countries you have more plastic surgeons in one city than we have in the whole country. But Panama is a very small country. It's 4.5 million people. But the other interesting thing is that this only happens in plastic surgery because we have cardiac surgery training, we have oncology, a surgical training, we have the people who are doing bone marrow transplants, and all these very highly sophisticated robot surgery with urology. All these other subspecialties have training here. I don't know exactly why, but for plastic surgery it has never been a possibility, although we've had the program ready to start training residents, and we've tried to do that a couple of times over the past 20 years. It never gets to be a done deal. Something happens with the government, it's not interested or it's not a priority for them. So the budget never gets approved, even though the plans are there. Eventually we're going to be training our own plastic surgeons. But for now, everyone here trained somewhere else.
Is a for-profit residency here in Panama even a thing? Because you mentioned the government does not give the budget. In Brazil, usually residency is paid. I mean, you get paid to be a resident, but there are a few, they're not exactly called residency programs, but they're equivalent. They're like for-profit programs. You have to pay to be a resident. There is such a thing.
Yes, and that happens well when you have cities of several million people who the hospital has a very large volume of patients who can actually subsidize that training. But for example, Panama City, it has about 1.5 million people. It's got 6 or 7 major private hospitals, and none of them have enough volume to train a plastic surgeon. We're very, very sophisticated subspecialty. So when I train, I have to go through craniofacial surgery. There's no private hospitals in Panama doing craniofacial surgery. That's only done at the Children's Hospital. And I also had to do burn surgery. So for that, I would have to go to the charity hospital. I'm not on board on the charity hospital. Then for cosmetic surgery, that cannot be done in any of the government hospitals by law. So it has to be done in the private hospital. So if someone was to start a private plastic surgery training, I would have to have agreements with the government, with the charity hospitals, and with the private sector, and that has not happened yet. We're still working on it.
And yet you ended up going to McGill in Montreal, in Canada, even though you had been in the United States before. So how did that happen, going to McGill specifically?
Well, when I started looking at programs for plastic surgery, of course, we didn't have Google then, so I had to go talk with professors. And I said, what are the top 5 or 10 general surgery and plastic surgery training programs? So I got a list, and I emailed and sent my application to all of them. And I was lucky enough to get into 2 or 3, and one of them was McGill. And when I saw that McGill was at the forefront of plastic surgery, many of the professors there that were going to be my professors, having been done many procedures for the first time. For example, the first microsurgery transfer of a muscle from one part of the body to the other part doing microsurgery had been done by one of my professors in Australia, and he came back and was the first person doing it in North America, and that was happening at McGill. Many of the studies of the brain and different parts of the brain were done at the Neurological Institute at McGill. Rutherford, who was a great scientist that many people know had to do with many discoveries in physics, trained and had his lab at McGill. The founder of Harvard University's surgical program came from McGill. So when I looked at McGill, was like the top of my list, and then when I got accepted, I said, there's absolutely no question. That's where I wanted to go. And then when I started looking at my background, it turns out that my mom's family is from Sherbrooke, which is the lower part of Quebec. They eventually moved to the New England, so I was actually born in Connecticut, but the family comes from Sherbrooke, which is French Canada. So I said, I'm going back to my roots. It's a beautiful country. It's a fantastic program. There was no question for me that that was the place I wanted to be.
You know, we mentioned like that bonds, the limitation for a small country like Panama, for example, it's smaller than many cities. I always say this, you think, for example, about São Paulo. I'm from close to São Paulo. The city of São Paulo has 23 million inhabitants. The country of Panama has 4 million inhabitants, so a single city is 6 times larger than Panama, almost. The cons is that for many like specialties, you don't get enough volume, for example, to train people. That's a con. A substantial pro, something I really like about the country of Panama is this like civis mundi culture, the citizen of the world. You get a larger country like Brazil or even the United States, you'll get a lot of people, for example, who live their entire life in the United States. I think like more than half of Americans don't have a passport.
That is
because
correct.
they don't leave the United States. Meanwhile, when you come to a smaller country like Panama, you kind of have to leave if you want to get training, if you want to do many things. So to some degree, there is also a pro there because you get a much more like cosmopolitan, open country, much more integrated with other places and other countries around the world. And your family's experience is an example of that. You were born in Connecticut, your parents used to teach medicine here, then you went there, you were born there, you came back, studied here, then went to Canada, then went to the United States. This is, as I'm beginning to see it from the people I'm interviewing, sure, given I'm interviewing somewhat famous people of a very high level, but from the amount of people that did their training abroad, I'm getting that this sort of traveling there and doing residency here in medical school, that is a very Panamanian thing to do as well.
Well, Panama is a very unique place. It's been, we call it the center of the world. I'm sure other places are also called the center of the world, but we call it the belly button of the world. From the time that Vasco Núñez de Balboa discovered the Pacific Ocean out of Panama, in 1506, I think it was very clear that this was going to be a passageway. When the gold rush was happening in California, it was easier to come through Panama, from New York to Panama, and then go up the Pacific than to cross the country. So Charles V of Spain in 14 something or 15 something wanted to do something so that they could break through Panama and communicate the Atlantic with the Pacific. So this has been a place of multiple cultures uniting and having no difficulty coexisting. When the Panama Canal was going to be built, it was started by the French, and they had earlier had a very large Chinese migration to build a transatlantic railroad from the Pacific to the Atlantic. And then Hindus came, and then a lot of people from the Antilles, Barbados, Jamaica, and others came to build the canal. And then after the pogroms in Europe or the famine in Ireland, we have very large migrations of Jewish people, of European people that have come for different reasons to do business and then decided to make Panama their country. So as I was telling Ricardo, as we're walking in the hospital, this is a very small hospital. I think it has less than 100 beds. However, there's a prayer room for Muslims, Christians, Jewish, and Orthodox Catholics, the Greek, and they're all in rooms one next to each other. And this represents what happens in the city. We have no trouble with people of different faiths doing business and coexisting peacefully without having ever a problem. I never had a problem with anybody of different religions, and we have Hare Krishnas, and we have everything that you name it and that you can think of lives in Panama and loves it and gets along very well. So that's part of our nature. We're very open. You can go eat and eat from many nationalities, very good food here, and something that you would only get at a very large city that happens here in a very small city, because we're a country of immigrants and everybody's more than welcome. Actually, Panama is the #1 place to retire for people in North America for the past 15 or 20 years. So somehow you grow up and you make your life anywhere, and then when you want to finish, you come to Panama. So welcome.
Yes, that's something I've also learned from talking to other people. Partially, this large connection with the United States is because, for example, the currency, the dollar, and the language. A lot of Panamanians speak English, albeit I'm going to disagree a bit on that, but fair enough.
Well, at the professional level, yes. Of course, at certain levels, no, they're Panamanian and they speak Spanish. But everybody involved in tourism does a little bit, and then everybody who has a college education will probably speak English.
At a high level, like when you're talking, for example, to medical doctors, the level of English fluency is one of the best I've ever seen. When you go a bit lower, when you talk about most service jobs, for example, then it drops a bit. It's worse than you would see in other places. But regarding the higher level, but you spent some time in McGill in Canada, and when you graduated, you did not stay in Canada. You moved, but not to Panama, but rather to the United States.
Well, my plan was to come back to Panama immediately, but some of the older people who are listening and viewing this, we had a dictator here called Manuel Noriega, who was involved in drug trafficking and many other things like Maduro in Venezuela. And we wanted to get rid of him, and it required a U.S. invasion of Panama to help us get rid of him, because he was also being indicted for drug trafficking. So he was being hunted by the U.S., and Panama was in agreement to getting rid of him. So that invasion of Panama happened right at the time that I was in the middle of plastic surgery with 1 year to go. So when that happened, of course, it took a few months for the democracy and everything to get reestablished. And at that time, I decided that I'm not going to go back to Panama. I had so much training, so many debts, and so many plans that I said, I'm going to go somewhere where I can really use all my training and be working full time. So I went to University of Miami and did a special fellowship training in craniofacial, which is head and maxillofacial, and then in aesthetic surgery. And that was from 1991 to 92, the beginning of 92. And at that time, I came back to Panama, looked at the options, and still were not a very promising or very lucrative as I wanted them to be, especially with very young kids. I wanted to be working full time all the time and for my kids to have everything available for them. So I decided to stay in Miami. I looked around and immediately I was offered a few options. So I decided to stay a couple years until things stabilized in Panama. But then you start a practice, the kids start going to school, they make friends. So it was a little difficult to leave. But my plan was to come back, so I decided I was going to stay a couple more years, but ended up staying another 9 years, so 10 years in total. But my goal was always to come back. So in 1999, I sold everything and moved to Panama with the whole family. And we're all very happy. We've been back for 25 years. And actually my kids that were born in Montreal and grew up in Miami are 35 years old today. I have twins. And they've been through the journey and they're very happy to be in Panama.
I mean, so first you moved to Latin America and then out of the United States back to Panama.
Yes.
Miami, capital of Latin America.
Having the best of the world at all times.
And you stayed 10 years there.
Yes.
Because very often when you talk, for example, about people who work abroad in other countries, it's very often that they will be like, well, I went for residency and then I say like 2 years for a fellowship. You actually spent 10 years there.
Well, for me, it was very important to validate all the training that I had. My father was a very strict scientist. So for me, it was very important to get the boards, which is a certification that you can work in the United States or in Canada. Because many of my friends who went abroad and studied, they were not tested. They went abroad, studied, and came back. I wanted to prove to myself that with the training I had, I could work anywhere in the world, or at least in North America that I wanted. So I wanted to do both my Canadian and my American boards, and that required that you worked in North America for at least 2 or 3 years after your training. So even though I finished in 1991, I was not able to get my American boards or my Canadian boards until 1994. And I'm actually very proud to say that I'm the only one of all my colleagues here who has that certification, because not only you have to have trained in North America, but you have to have worked. And for me, that was very important to validate that whatever I learned, I was good enough to work anywhere in the United States that I wanted. And I actually got offered some positions to stay as a professor or stay in academics, but I wanted to come back to Panama. I was very involved in Operation Smile, helping kids with no resources to fix their facial deformities. So I wanted to give back something to the country where I had grown up. So for me, it was very important to have that certification, but still make the choice to come back to Panama. And I've been very happy and pleased with being able to do that.
Tell me again, because they haven't heard it yet, the story about how you start operating here in Panama while still being in, let's say, the wedding thing.
Well, as I said, I was planning to come back to Panama, but I was not doing anything actively. And when I went into private practice, I immediately got very busy because I started working as a solo plastic surgeon in Miami in July, the 1st of July of 1992. And in August of that year, Hurricane Andrew came and it destroyed half of South Miami. And it turned out that I was the only plastic surgeon in 2 hospitals that I worked who could do microsurgery who could do hand surgery or who could do facial trauma. So I got immediately busy very quickly. And sort of one thing led to the other. The kids were happy, they were in school. I was super happy being a plastic surgeon and being extremely busy. So I just let the years go by and had put the dream of going back to Panama on a second nature. But in like 1996, I came for a wedding in the Christmas holidays, and I got a call from one of my sister's friends from childhood, and she says, I know you're coming for a wedding. Would it be possible for you to operate on me while you're here? Because I can't afford to go to the United States. I said, sure, no problem. So I did the surgery, had my holiday, went back to Miami. Everything was okay, forgot about that. And then a couple of weeks later, one of my assistants in the office tells me, doctor, people are calling from Panama asking, when are you going to go back? And I was like, well, tell them that I'm not planning to go back until the next holiday. And she says, no, you are going back. We're going to set up a schedule and we're going to put a date, let's say April, and we're going to say, you're going to go April. So she started taking calls, and then all of a sudden I had like April, July, and August. I came 3 times that year, and I would work for 1 week, and I would do 8, 9, 10, 12 procedures in 1 week, and then go back to Miami to take care of my practice there, operate there, and then come back on the weekend here and see my patients. And that went on for 1997 and 98, and it was very tiresome, but I was full of energy and wanted to do it. I was super excited that I was being busy in both places, and I love to travel, so I had infrastructure both in Miami and here. I had assistants that could help me make sure that the patients were very well taken care of while I was not here. And I was sometimes going back and forth every week. And I did that for 2 years. And then at that time, I realized that Panama had evolved into a very stable democracy. And in 1999, they elected a female president. And I said, if Panama can elect a female president and we have a stable democracy, this country is really, really moving forward, really getting modern, we're getting proactive. And I said, I have to go back. So I said, talked to my wife at that time. I said, we're selling everything. I'm going back to Panama. We're going back in 1999. I sold the house, sold the practice, sold the car, kept the pets, and moved to Panama. And I've been here working at the beginning of 2000, and very happy that I was able to do that.
And so far, how much longer are you going to stay here?
Well, not sure, but I'm sort of dividing. I worked 10 years in Miami, 10 years in a hospital that was started by my dad called Centro Médico Paitilla. Then I worked 10 years at the Punta Pacifica Hospital, and now I'm at the Panama Clinic, and I'm on my 5th year here. So thinking that if my career is maybe 40 years, I have maybe another 5 or 7 years to go here. I don't know when I'm going to retire. If you ask me now, I say never, because I'm full of energy. I feel the best that I've felt in many, many years, health-wise, and the practice is super healthy. I have about 30% of my patients come from the US or Canada, so I'm busy, loving what I do, so I'm gonna be here for a while. But yes, I've moved back and forth, and I like that. I mean, so are my kids. Like my daughter, she was born in Panama, then she went to school in Montreal, she learned French, then she lived in Miami, so she learned English. We also spoke English and Spanish at home. So my daughter speaks 3 languages, and my younger sons, which are twins, and they actually turned 35 yesterday. They were born in Montreal, but then grew up until like 9 or 10 years in Miami, and now they're here. So they have 3 passports, speak 2 languages, and I think that's the beauty. You know, the more the merrier.
Buenos dias. Today we are here at Dr. Luis Picard-Ami's clinic. So let's get to see it. Yesterday we talked down there close to the food court there in the main business center there. I'm not sure how they call it. It's a kind of a mall. Let's take a look here today. And I speak here and became was first outside. Buenos dias, less than usually. Garcia, this question. It was still how is different overstated for us to build today in around 2000. I know we don't fly more so. Here. Thank you for work and give my just like this. I don't know. Really close ends. But I guess instead of further herb fields are not any third times a day. They're more like separate. Oh, maybe then. So this one will step up. The food is going to stop. So empty. Because you're right, they are.